For Medskl.com, I'm Dr. Sanjay Sharma, and welcome to If I Knew Then, a show that's based on a simple premise that when everything is said and done, life comes down to a few key moments. On today's show, we're thrilled to have Dr. Danielle Martin, who's an associate professor of the Department of Family Medicine and Community Health at University of Toronto. She's also a best-selling author and the author of Better Now, a book that's really dedicated to changing the healthcare system for Canadians. She's also one of the 50 most influential people according to Toronto Life. Welcome to the show.
I did my undergraduate training in science, in biochem, and I didn't come from a family that had any doctors. I'm the first person to pursue a career in medicine in my family. I did come from a big kind of social justice oriented family, so lots of kind of values-based conversations growing up about the need to, whatever you do in life, try to make the world a better place, sort of thing. And I had an amazing grade 10 science teacher who kind of picked me out and said, I think that you could really do something in science. I had never considered science as something for my future. And he got me enrolled in summer programs and really supported me. And I ended up choosing to go to McGill to do a bachelor's and honors degree in biochem. And from there, I graduated. I needed a job. I didn't know what to do. I called a friend of my parents and asked if she could help me get a summer job, and ended up, through a series of coincidences, working in politics.
Oh, wow.
And so I spent, completely random. I spent a couple of years working in healthcare politics and healthcare policy.
And that was in Montreal, or that was in Ottawa?
It was actually back in Toronto at Queen's Park in the Ontario legislature. And that was what kind of ignited my passion for healthcare systems and healthcare policy. And I came to the conclusion that if I really wanted to make a difference in improving the healthcare system, I was probably best to pursue a career as a healthcare provider so that I would have some idea of what it's like on the ground. And so I applied to medical school and ended up going to Western in London, and came back to do my residency in Toronto. I worked up north when I first graduated in Northern Ontario for a number of years, and then fell in love with my partner, husband, and ended up back here in Toronto. I've been here permanently since my daughter was born 9 years ago.
Wow, that's interesting. So, I mean, obviously that's a pretty atypical route, I would say. Just looking at my own medical school, I graduated from Dalhousie, and my medical school class, I think the vast majority of people, had undergraduates in whether it was biochemistry or biology or just chemistry, but I think very few went into kind of a 2-year stint into politics and policy right out of the gates. So, I mean, how did that particular background, was that advantageous, disadvantageous for medical school specifically?
I mean, for me, it's funny you said that life comes down to a few key moments. For me, that was a key moment for sure. And I think that the kind of traditional track for physician leaders or clinical leaders is often you go into medicine because you want to do patient care, and then you slowly over time discover that there are things that you want to do to make life better for your patients that you can't do one patient at a time, that you have to kind of look at the bigger picture and get involved in, whether it's administration or policy or guideline setting or leadership in a variety of different forms. But it starts with the individual patient, and then people's passion for kind of system change becomes an extension for that. And for me, it was just the reverse. I started out believing that a well constructed healthcare system at the policy level was critical to the health of the community that I live in, and I wanted to help to make that system better. And I went to medical school because I wanted to understand I wanted to see that world from a different perspective. I actually think, if I'm honest, when I went to medical school, I wasn't sure that I would ever practice medicine. I thought I would go straight into administration or policy. And then I fell in love with family medicine, and that was the end of that, another key moment in my life. But I didn't expect that. I expected to keep that kind of focus on the big picture from the outset. And so for me, it was really formative.
And what was it about family medicine that you know just said, yeah, this is definitely something? You said it was unexpected. So what was it specifically about family medicine that really excited you?
Oh, I mean, for me, it's the relationships. That's the thing that I think most people in primary care will say. And of course, you can have relationships with patients, even sometimes over many years as a specialist. But, as Ian McWhinney, one of the fathers of family medicine, once famously said, in family medicine, we know the patient before we know what their disease will be. And that's the difference, is
That's good.
that kind of longitudinal connection with a human who will go in and out of different moments in their lives where they might need you, from very straightforward medical problems to their marriage falling apart, to a very serious diagnosis, to a diagnostic dilemma. And it's the accompaniment of people through that kind of rhythm of their lives, regardless of what the pathology might turn out to be. That is it's very special, and it's yeah. So that's what keeps me in it, for sure. And long after the uh, the common medical problems become sort of a routine part of your day, the people are never routine. They're always a surprise to you,
That's very true.
and that's what keeps it real.
Yeah, that's interesting. You touched on, earlier on in the conversation about, someone who, I guess it was your grade 10 science teacher who really believed in you and was, almost a mentor early on. Have you, I'd like you to speak maybe to the concept of the importance of mentorship, and maybe just take us through a few mentors that were important in your, various phases of your career.
Yeah, I mean, I've been very lucky to have some extraordinary mentors in my career. One thing that I'll say is that the way that I interact with my mentors has changed over time. I think when I was early in my career, like back in those younger days, your mentors, whether it was your teacher or your uh, that family friend who got me my first job at a university. These are sort of people that you went to for everything, people who you went to when you needed advice about anything at all. And they were champions as much as they were mentors, kind of opening doors or introducing you to people or helping you get a shot at something that you might not otherwise have a means of getting a shot at. And they did it because they believed in me, at something that I have tried to remember, in order to try to pay that forward for young people I see who I believe in. But actually, as I've aged and developed experience in my own career, I've come to realize that most people are best placed to be mentors for something in particular. And so, there are one or two people who I will call before any job transition, before I ever take any job, because I know that they have really good insight into that. But I will call somebody different if I'm struggling with how to deal with a difficult personality at work or manage a conflict. And I'll call somebody different again if I'm struggling with something to do with my kid. And so, you kind of develop a group of people who play that function in your life, who may not interact with each other ever or know one another, but who play different roles. And I think A, you get great advice that way, but also B, it stops you from exhausting your mentors, because to go to the same person over and over for everything and to always need 90 minutes over coffee or whatever is a lot to ask. But anybody can give you 10 minutes and give you 10 minutes by phone. And so I've also been trying to take that approach more with younger people who reach out to me for mentorship, because I never want to say no, and I don't always have time to, develop an ongoing connection with someone. But those brief, just in time conversations about something in particular, I can commit to. And you might accumulate a few of those conversations over the course of your relationship with someone. And they can be very meaningful, but they don't have to be super intense in order to have that meaning.
Yeah, that's great advice. It reminds me of a book that I read, Tribe of Mentors by, I think it's Tim Ferriss. But
Hmm.
it's yeah, I mean, I think you're absolutely right. As a student who's potentially looking at getting a mentor, you know, you have to be respectful of the mentor's time. And I think B, you're absolutely right. I mean, there's, for a specific problem, there's a few mentors who can really answer that, and give you the background how to make that decision. So I think that's terrific advice. Um, why don't we move on to your book? So walk me through, a, how someone writes a book, and B, kind of the sort of passion around, how that book came about.
Sure. Well, I had been through a period of a number of years where I had been doing a lot of public speaking. And so I had written a lot of articles and a lot of speeches on different topics that I felt strongly about, and had kind of accumulated some expertise about those topics over time. And at some point, I looked at that accumulated set of products and thought to myself, I feel like I could just stitch these things together and they would be a book. I've probably given 18 talks on the need for national pharmacare, and 13 talks or articles about poverty and health and the need for a basic income guarantee or whatever. I mean, surely if I just took all of these things and wrote some good transitions, it would be a book. And I was so wrong. I was terrifyingly wrong. I thought it wouldn't be very much work. And it turns out that actually, although having done all of that stuff had given me the kind of the necessary content expertise to know what it was I was talking about, that the process of writing turned out to be something very different. And so again, I reached out to experts, people I knew or who I, had a connection to, who were accomplished authors, to say, how do you go about doing this? And of course, like anything else, it turns out to be a discipline and a set of skills that one of the people I spoke to, I never got to this level of achievement, but he described for me that he would have out, for example, the outline of the whole book, and then the outline of the chapter, and then the outline of the subparts of the chapter, and then the outline of the paragraph, so that by the time he sat down to write, he would know exactly what needed to, how many sentences in that paragraph and what point needed to be made.
Wow.
Uh,
He
which is
must be an engineer.
Yeah, no, it's funny. I won't reveal my source, but he's a very successful Canadian author, and in fact a fiction author. So
Interesting.
imagine
Wow.
someone being able to do that with fiction. Anyway, so I kind of bumbled around, and what I managed to get together was enough of an outline that I had a sense of what I wanted to do, and then a chapter. And that was what allowed me to then go out and get, as I've learned, you need this most of the time. If you're going to try to publish with a trade publisher, you need an agent. You can't just send your book to people and assume that they will read it, and then the agent shops it around to publishers. And then once you have a publisher, you get an editor, and then the editor helps you turn, your okay book into something that people will really want to read. And so I learned a ton from that process. It was an amazing, and for me, it actually went pretty fast. I would say it was about 18 months from start to finish,
Wow.
which in
That is
that
fast.
university,
Yep.
especially because I was working full time. But and so all of that pre-written stuff was helpful in that it was already there for me to put to paper. But it was a lot more than just stitching together a few speeches.
And the core passion behind doing that. I mean, you kind of alluded to your family being, your discussions, I guess, around the dinner table growing up was, largely driven by social action and equality. Was that was really that the roots for this, or was it, more things along the way?
Yeah, I mean, I think for me, a big thing that I have found troublesome about the way that Canadians talk about healthcare is that it's a very polarized conversation, and you get kind of painted into this corner that either you think the system is terrible and it's not serving anybody well, and it's a disaster, and it's falling apart, and it's unsustainable, or you have to think that it's perfect and nothing about it needs to be changed. And you have to defend its every, its every failing and every imperfection. And my experience of the healthcare system is that it's much more nuanced than that, both as a physician working in the system and as an administrator and as a patient and a family member. There are lots of things that I think actually work really well in our healthcare system. And also, I am a huge believer in the basic values that underpin our system, most especially the value that access to healthcare services should be based on need, not ability to pay. I think that that's a really fundamental shared Canadian value that we shouldn't take for granted and should be very proud of. But that doesn't mean I don't think that we've got big problems. We need to fix wait times, and we need to fix poor Indigenous health outcomes, and we need to fix people not being able to fill their prescriptions at the same time that lots of people are having massive amounts of overprescribing. Like, there's lots of stuff that needs to be fixed. And so what I wanted to do with the book was to try to move the conversation that people are having, whether it's in the newspapers or at the dinner tables, in their home communities, from a conversation about either it's all good or it's all bad, to a conversation that basically says there's good stuff about it and it needs to be better, and that the better part is achievable. We know what the fixes are. We could actually, if we all rowed in the same direction, we could move some of these move on some of these problems that people experience in the system every day, and so that it feels concrete, achievable, not just sort of a bunch of airy-fairy recommendations. And so, yeah, that was really the impetus of it for me, was to try to move out of that black or white kind of dialogue that I was finding very frustrating, and that I was constantly being pushed into. I was frequently getting asked to do debates, against this person or that person on a panel at a conference, or because they always wanted somebody to say everything was great and somebody to say that everything was horrible. And I just find that really facile as an analysis.
And I'm assuming the better now means the better healthcare system should happen now, and it sort of suggests a systems or an action element to it.
That's right. That's right. That we shouldn't wait, that we need to get on it. And interestingly, speaking of the process of writing a book, I have vivid memories of being in the publisher's office in a room with a whiteboard with a bunch of people spitballing names, and we tried every variant of better. First they wanted all better, and then I said, well, we can't do all better, because even though it's got that nice medical connotation, it implies that if we do these 6 things, it's all going to be all better. And of course, it's never all better. That would better yet, and better, and more better, and better this and better that. And better now is where we finally landed. Better on its own, of course, had already been taken by Atul Gawande. I cede that to him.
Yes.
But
yes.
But there are, anyway, the notion is that it's a journey, but there's a lot of stuff we could do right now, that nothing is standing in our way from making things better.
I think it's a great name. Congratulations. Here's a question from Sachin, who's a third-year medical student, and I think it's a good time to ask it now. So he's wondering about reducing unnecessary testing in the healthcare system. Is there a way to, either incentivize doctors to cut back on testing that may or may not be, necessarily appropriate, or incentivize, I guess, the alternate behavior? Just thoughts on that in general.
Sure. I mean, I think the first thing I'll say is that what I think the Choosing Wisely movement has got right about the conversation around unnecessary and inappropriate tests and procedures and prescriptions is that it is a focus on quality and on harm caused by unnecessary testing. It is not a focus on money saving. I think that's really important, because I think Canadians are not really interested in a conversation about how to save the healthcare system money. If they think that they need X, or that X would somehow be of benefit to them or their loved one, they're going to want it. And that's totally understandable. They should. What we need to do is paint a better picture, both for clinicians, whether they're doctors or nurses or whoever, and for patients about how much harm comes to people as a result of inappropriate use of medical interventions. And so in the book, I talk about the story about a real guy who's I call Sam, who went to one of these executive physicals clinics and had a screening stress test, even though he was perfectly fine and had no symptoms of heart disease. And one thing led to another, and he ended up having an angiogram, which confirmed that he didn't have heart disease, but not before he suffered a stroke as a complication of that unnecessary angiogram. And so
Wow.
that's a pretty extreme story, but actually Canadians every day are harmed by side effects from prescriptions for medications that they don't need or that are of no benefit to them, and they get led into the spiral of investigations. Not to mention the number of people who are waiting for procedures and interventions that would help them, but waiting unnecessarily because half the people on the wait list are waiting for something that isn't actually going to help their health. And so I think that the conversation to be had is around quality. I worry about financial incentives, to answer, I think you said it's Sachin's question.
Yes.
Because I think that financial incentives vis-a-vis patients are dangerous, because patients often do not know the difference between chest pain that is related to reflux and chest pain that's related to angina. But if they are living in poverty where a $10 user fee at the emergency department makes a difference to them, they will stay home. And we don't want people staying home when they're potentially sick. And so I think that asking, when there's so much asymmetry of information in a system, when patients know so much less than their care providers, to expect patients to respond to economic incentives is, I think, a dangerous game to play. When it comes to clinicians, it turns out that that's also complicated, because we know from some of the so-called pay for outcomes research that's been done in the United Kingdom that sometimes if you incentivize physicians to, for example, keep people's blood pressure under control in their practices, that they may be more likely to reject low-income patients or patients with mental illness or patients who are not likely to follow their instructions or adhere to their treatment plans. And so again, you end up creating perverse incentives. So I'm not yet sold on the notion that people should be paid according to keeping, doing things or not doing things at that kind of a granular level. I am very sold on the idea that we need to be having this culture shift around reducing harm that is preventable.
Now, for a lot of the medical students who are listening, and you talked a little bit about, I guess it was in Random House at the whiteboard. If we're at a whiteboard level, you obviously have some phenomenal ideas. How do you actually get that to make those ideas or get the ideas into a policy change? Is that an easy thing to do, and how do you actually go about doing that?
Oh, of course, it's an incredibly hard thing to do. What I will say is that there are things within each of our spheres of control. And one of the things that I learned very early on as a medical student is that you shouldn't wait until you are in what you perceive to be a position of power to start to try to make things better. That's an obligation and responsibility that we each carry no matter where we are. And actually, even as a medical student, you're already in a tremendous position of privilege to be able to make changes. So, the little group of activist students who I hung out with in medical school organized around trying to, reduce tuition rates. And we are organized around trying to improve women's health education in our curriculum. And we organized around trying to, go to high schools in marginalized and vulnerable neighborhoods to get young kids excited about a career in medicine. So, there are lots of things that you can do that are inside your sphere of control. If you make the mistake of believing that the only thing that will make the healthcare system better is to change the laws and the regulations, then you can spend a lot of time feeling powerless, or spending one day a year going and lobbying members of parliament or MPPs about a policy change, and then going back to your own environment, not doing anything in your own environment to address those issues. So it is, of course, important that we all be involved as citizens in trying to make big, large-scale policy change. But if you have a summer research project, you can choose to orient your summer research project to help contribute to the body of knowledge needed to make a change in healthcare that you think should be made. And so each of us has got within our own sphere of control things that we can contribute to.
Yeah, and I think that's an incredibly good point. I mean, I'm just, what was going through my head was I just saw something yesterday. I think she's a 15-year-old, maybe Swedish or Finnish girl, and she's, speaking up quite a bit around climate control and challenging a lot of the politicians and just saying like, who's the one who's more mature here at the discussion right around the table. So, and I think with social media and an empowerment of really anyone on the planet, I think that's really, really important to remember. So I think you're right. They can start, the medical students can really start at ground zero right now. So that's great advice. Here's I know another large part of your life is kind of administration at the Women's College Hospital. And so here's a question from Tiffany, who's a first-year medical student from University of Calgary. And she writes in saying, in 2013, you co-founded an Institute for Health System Solutions and Virtual Care. So if you could walk us through what that project is about and how it works, that'd be great.
Sure. So this is the world's worst acronym, Women's College Hospital Institute for Health System Solutions and Virtual Care, WIHV. We call it WEAVE. We're waiting to get a really big donor to, give us $1 zillion, and then we'll name it after that person. But in the meantime, we're called WEAVE, and our work is really around trying to find new ways to deliver healthcare services that will improve people's health while saving the healthcare system money. Sometimes those things use technology. So for example, we have launched here at our hospital a same-day hip and knee replacement program where we have people who come in the morning, and within 6 hours, they've had their total joint replacement and they are home.
Wow.
And they follow up with their team using a tablet-based technology, and can kind of interact with their healthcare team from the comfort of their homes as they recuperate. Because as we all know, hospitals are actually not always the best place for people to be. These high risks of hospital-acquired infections, people can fall, injure themselves. So for some portion of the population, we believe it's about half, recovery at home is appropriate for an operation like a same-day knee or hip replacement. And if you think about how common that procedure is, it's the most common surgery that Canadians are admitted for in the country on a planned basis, and we have an aging population. If half of our hip and knee replacements were done on a same-day basis rather than having people sleep over in the hospital 2 or 3 nights, that's a tremendous wait time reduction strategy and a tremendous cost savings potential strategy. And so those are the kinds of things that WEAVE is helping to support. I mean, we're not doing all of the clinical work. Our amazing clinical teams, the surgeons, the anesthesiologists, the nurses, in the operating rooms have, fine-tuned the procedure in order to get our patients home on the same day. But our team does the evaluation of models like that. So it's a sort of an innovation/research group. And we help to support the tech side of it, using technology to support these new models of care, not just bringing in technology because it looks cute, but actually because it supports new ways of doing things that we believe have both positive patient impact and positive system impact.
Yeah, it's interesting. I mean, the other thing I was thinking about a little bit is going to a couple of different conversations that I had. One was, I remember distinctly when I was at Dalhousie the very first day we started medical school, I think one of our deans came in and said, you guys are like the chosen ones and all this kind of stuff. And I think sometimes in medicine we get this, relatively myopic, or siloed mentality. And it wasn't until I did my MBA that I was surrounded with like electrical engineers and mechanical engineers that I really understood the value of what it was, to have a team, totally. Some technical people and just, arts people. And so, when you're coming at these system solutions, I think you really need to design them with a variety of people. who are evaluating what you're doing, and it sounds like that's the line of thinking that you guys are on as well.
Totally. We have anthropologists on our team. We have human factors design people on our team. There are engineers. We have students from the Ontario College of Art and Design who are doing there's a design master's in healthcare at OCAD. So, again, these are people who come
Wow.
from an art background participating in this. So it's very interdisciplinary. And, to your point, interdisciplinary doesn't just mean doctors and nurses and OTs
Yeah.
or ophthalmologists and family doctors. It also means, truly interdisciplinary, drawing from the wisdom. And we're very lucky here in Toronto that we're part of a big university that has really smart people from all over the world in all kinds of disciplines that we can forge those partnerships with. So it's very exciting.
Yeah, absolutely. Here's a question from Natalia from the University College Dublin. And she says, she's asking, you've worked as an advocate for the improvement of public health in Canada for over a decade. What motivated you to get involved in areas of healthcare policy and healthcare systems?
Well, I think for me, as I'm sure is the case for so many medical, I think it's important that we use the skills that we have been given as physicians to try to support and help our patients one by one. But we also need to use the platform that we're given as healthcare leaders to help, people in much larger groups than that. And I think, people who've been practicing clinical medicine for a long time would probably agree with the statement that, once you've seen your 10th or your 15th or your 20th version of the same thing, you can't help but ask yourself, how could I stop these people from showing up in the first place with this problem? And the answer to that is policy change, system change, action on the social determinants of health, improvement in the conditions that lead to illness. I think it was Virchow, actually. I'm pretty sure it was Virchow, the one who's famous for,
The
the
node,
lymph
yeah.
node up here, who once said that politics is medicine on a grand scale. And I think that that's true, or maybe it was the other way around what he said, but anyway, I think that those, if you are dealing in the realm of human health and illness and disease, you cannot fail to see the ways that policy influence health. And so we need to do both.
So what's next up for you? What's your next big project or or area of interest?
I am very taken with the work that we're doing here at Women's around trying to implement some of the kinds of big ideas that I talk about in that book. I think I'm at a stage in my career where I would like to get into the weeds a little bit and figure out how we can have a bit of a demonstration project for the kinds of solutions that that people have been talking about in the healthcare system in Canada for a long time. So I think I'm going to be much more engaged in these kinds of new models of care delivery, which we will publish on in the academic literature and in the Globe and Mail, if they'll take our op-eds and all of that kind of stuff as well. Try to communicate out to people what it is that we're trying to achieve. But I'm very interested in changing some things that I can touch and see that will really affect actual patients and hopefully the healthcare system. So that's where I plan to be.
Sounds great. Now, obviously, you've had quite a storied career, and for our medical students out there, I mean, how do you really balance a lot of competing, demands, I guess, on your life, whether it's administration, whether it's family, whether it's academia, kind of thoughts on how to put it all together.
I think for me, the biggest thing has been two things, I guess. One is to know that balance is not something that you ever find in the moment. It's something that you have to have a bit of a longer time horizon about balance. So in any given day, you might do too much of X or not enough of Y, but you just want to make sure that in a given month, you're not dropping the same ball over and over again,
Right.
as you try to juggle things. So sometimes work demands or family demands or, other needs demand your full and focused attention in order for you to be good at whatever that thing is. And when that happens, you need to be able to just put everything else down and focus on getting that thing right, whether it's your kid or whether it's your, the paper that you need to submit or the job that you're applying for or whatever. But then you need to know that it's time to, pencils down on that and move on to the next thing. And so the balance gets achieved over that time horizon as opposed to in a given moment. You can give yourself a bit of a free pass on the moment to moment stuff. And then the second thing I will say, which I've said before to medical student audiences, is that I really worry about the kind of work-life balance frame that I hear being discussed a lot with relation to physician burnout. Doctors are reporting high levels of burnout in Canada and internationally. And we seem to think that the solution to that is, as I put it, yoga classes and pizza parties. And I just don't think that there's any amount of yoga or pizza that is going to help people feel fulfilled as humans in the work that we do. I don't like the insinuation that my work needs to be balanced with my life, as though the work is something that is anti-life and the life is things that happen outside of work. Actually, my work is really central to my life. I really love my work. I get a lot of joy from it. I get a lot of fulfillment from it. It means a lot to me. And it's a big part of who I am. And it's not just good for other people, my work, it's good for me. And so that doesn't mean that I never go to a yoga class or a pizza party, or that I don't take vacation with my family, or that I, don't value things that are traditionally called life in that balance. But I think that we set ourselves up to get burnt out if working is felt to be some kind of a hardship. Actually, the work that we do is a huge privilege, and we are well paid and well respected and get to do things that matter and help others. That's fulfillment. And so let us integrate work into our understanding of what it means to have a good life.
Yeah, I think that's incredibly important. When I talk to students, I also try to convey the concept that, I mean, you're spending, 8, 10, 12 hours a day at, work. Wouldn't it be great if you choose something that you're incredibly passionate about? And
Right.
so that's when the endorphins are being released, and that's when, really, if you love what you're doing, it's almost like a Zen moment in itself.
Totally.
And that's at the end of the day, if you have those Zen moments, you really realize, hey, I picked my career properly and correctly, right? So,
Exactly.
one last question for you. Advice to your 25-year-old self.
I would tell my 25-year-old self to breathe. I think I felt, and I see this in the students and trainees who I work with, this incredible pressure to deliver on all of the things immediately, right away. You have, hopefully a long career ahead of you, and it's not a sprint, it's a marathon. So being able to enjoy the moment that you're in and not be constantly pressuring yourself about what you need to be doing next or thinking about that. I guess it's a mindfulness stance in a way, to just be where you are, and yes, make the best of it and the most of it and contribute the most that you can, etc., but not be constantly worrying about the next thing. I think I would have been happier. Looking back, I had actually lots to be happy about. And I wasn't unhappy, but I think I felt as though I had to achieve all the things all at once. And it turns out actually, like, I've had plenty of time to do those things. I didn't need to worry about it so much.
Well, Dr. Martin, it's been a pleasure to have you on the show. Thanks so much for joining us. It's been a delight to talk. And to everyone out there, thanks so much for tuning in. If you like what we're doing, just remember to subscribe. Definitely tune in. We're working on a number of other shows. And if you have any questions for other guests that we will be interviewing, definitely just drop us a line. Thanks very much.
Thank you.